And now for the latest on the pandemic and what's next, we welcome back Lieutenant Governor and the state's COVID-19 liaison, Dr. Josh Green. Good morning, Lieutenant Governor. Thanks for joining us once again.
Good morning.
Let's go ahead and start with the numbers. The cases seem to have dipped a bit in the past couple of days, which is good news when it goes in that direction. The hospitalizations just under 400, though. Will we continue to see a downward trend in the cases, and the healthcare workers who are here temporarily helping out, will they be here long enough to help us get out of this peak?
The answer is yes. The healthcare workers who are visiting, they number 673. Those are mostly nurses and respiratory therapists. They will be here for another 6 to 7 weeks, and they're incredibly impactful, helping to dispel our brave healthcare workers. So they will be here long enough. We are 6.7% off of our peak. We peaked at 58,521 active cases of virtually all Omicron. And now, as of yesterday morning, we're at 54,618. That's 6.7% or 3,900 people lower. It's very important, but we also still have the hospitalizations. And remember, these are people. These are people who are struggling and suffering in the hospital. We had 55 people in the intensive care unit sometime midday yesterday because they get very sick if they haven't had a booster, and it's problematic. But the cases have been dropping overall. We do appear to have peaked in the hospital, I believe, sometime in the last 3 days, although it usually trails by 7 or 8 days, the number peak. So it will tend to drift a little bit and then finally drop off.
Now, there's a new variant out there. What can you tell us about it and your level of concern?
Well, it's called BA2, and the variant itself is a subvariant of the Omicron variant. So it's not sufficiently different to merit changing its name completely. The next one up probably would have been Pi, Omicron O and then Pi. So it's a smaller change. It's in the S protein. And what happens is these things change a little bit, and then they become either more infectious or less infectious, more severe or less severe. Usually they become more infectious so they can spread without hurting their host, which is us. I think that it's going to eventually take off. Like you said, it's in 40 other countries. We will see cases of this, but all indications so far are the same. If you get your vaccination and then you get your booster, you're not as likely to be hospitalized. If you've had a booster, you're 90% less likely to end up in the hospital than if you have not been fully vaccinated.
Pfizer is now studying how a modified vaccine would work against the Omicron variant. When could we see an Omicron-specific vaccine?
Usually it will take a couple months, which is actually an extraordinary thing to say because it used to be 5 or 10 years in development. Now what they do is they just modify the genetic code or the sequencing of the mRNA just very slightly to directly create antibodies or an antigenic response to the new variant, which means that you get the proteins to look a little bit like the virus, in this case the Omicron variant or even the BA2 variant, and then the body makes antibodies that will go and kick that one out. So that's the approach. They talked to me about this on several occasions. Amazingly, they can do the biochemistry in just like 5 weeks, but then they have to test to make sure everything is still safe. It's a much quicker process than we ever saw before.
And finally, boosters. For some people, especially healthcare workers and first responders, it's been about 6 months since they received their booster. Are they still well protected? And what's the latest on the need for a 4th shot?
They are well protected. In some countries, especially those that started extra early, they're recommending a 4th shot. We're still waiting to see the data on that to see if it actually helps. We've had 480,490 people get boosters in our state as of yesterday afternoon, which is about 31% of our population. Some people are eligible, some aren't yet. I had my booster 4 months ago. But in those other countries, they boosted people who were healthcare workers over age 60 or immune suppressed. Those are likely the groups that are going to be most vulnerable and probably who will be recommended for that 4th shot. The immunity, as we know, does wane usually after about 5 months, and that's why the recommendation to get the booster after 5 months has occurred.
All right. Well, we thank you so much, Dr. Green. We always appreciate your time and your insight. You have a good day.
You too. Take care.